Welcome back, friends, to another episode of the Juicebox Podcast.
Hi, my name's Tiffany. I have had some form of diabetes for the last 11 years and recently found out within the last 2 years that I'm actually type 1.
Nothing you hear on the Juicebox Podcast should be considered advice, medical or otherwise. Always consult a physician before making any changes to your healthcare plan. Don't forget to save 40% off of your entire order at CozyEarth.com. All you have to do is use the offer code JUICEBOX at checkout. That's JUICEBOX at checkout to save 40% at CozyEarth.com. AG1 is offering my listeners a free $76 gift when you sign up. You'll get a welcome kit, a bottle of D3K2, and 5 free travel packs in your first box. So make sure you check out drinkag1.com/juicebox to get this offer. Are you an adult living with type 1 or the caregiver of someone who is, and a U.S. resident? If you are, I'd love it if you would go to t1dexchange.org/juicebox and take the survey. When you complete that survey, your answers are used to move type 1 diabetes research of all kinds. So if you'd like to help with type 1 research, but don't have time to go to a doctor or an investigation, and you want to do something right there from your sofa, this is the way. t1dexchange.org/juicebox. It should not take you more than about 10 minutes. The episode you're about to listen to was sponsored by Touched by Type 1. Go check them out right now on Facebook, Instagram, and of course at touchedbytype1.org. Check out that programs tab when you get to the website to see all the great things that they're doing for people living with type 1 diabetes. Touchedbytype1.org. The show you're about to listen to is sponsored by the Eversense 365. The Eversense 365 has exceptional accuracy over 1 year and is the most accurate CGM in the low range that you can get. EversenseCGM.com/juicebox. This episode of the Juicebox Podcast is sponsored by Medtronic Diabetes and their MiniMed 780G system, designed to help ease the burden of diabetes management. Imagine fewer worries about missed boluses or miscalculated carbs, thanks to meal detection technology and automatic correction doses. Learn more and get started today at medtronicdiabetes.com/juicebox.
Hi, my name's Tiffany. I will be 42 in 3 weeks. I have had some form of diabetes for the last 11 years and recently found out within the last 2 years that I'm actually type 1.
Last 2 years?
2 years, yes.
How does... okay, let's go through that. But first, I want to tease people out a little bit.
Sure.
You have a great story, but you're on the podcast most specifically because you saved yourself with Gvoke HypoPen recently. Is that right?
I did.
Okay. All right. We'll get back to that. Sorry. I just, want to make sure people hang on because it's going to be a good story. Let's see. 42 now, just about your birthday. Happy birthday.
Thank you.
Maybe we share a very similar birthday. I'm the 12th.
That's my daughter's birthday. I'm the 21st.
Oh, congratulations. Arden's is the 22nd.
That's so cool.
Yes, please don't send cards. Let's see. What does it mean you've had diabetes for 11 years? How were you diagnosed?
Oddly enough, I was diagnosed with pre-diabetic. We were trying to have our first daughter, and we were having trouble conceiving.
I see.
So the OB did a whole bunch of the fun little blood work that they do, came back as pre-diabetic, changed the way I was eating, cut out all of the extra fruit I was eating, and was able to get pregnant within like 3 weeks. So they immediately put me on insulin, sent me to a diabetic educator. But again, no one told me how to actually use the insulin or that my insulin needs would vary greatly while I was pregnant.
Hey, wait a minute. So did they see you as pre-diabetes type 2?
Yes.
Okay. And so oh, that's interesting. So you got your blood sugar down a little bit, that got you pregnant. And then you don't have any direction, even through the pregnancy, about how to manage?
Just a whole lot of threats from my OB that if I can't get my blood sugars under control, My baby is going to be in the NICU, overweight. I would cry leaving every OB appointment, and I'm not the type of person to cry regularly. So I would be so upset, probably because of the hormones as well. But I would be so upset leaving those appointments because they were threatening me about my blood sugars. And I was doing everything I could to keep them in the range that they wanted them in, but there was no education really offered on exactly how to do that.
So the OB sent you to an endo?
No.
Who gave you the insulin?
They did give me a referral for an endo, but the OB actually first sent me to a nutritionist.
Okay. Yeah, well, I'm in the very beginning, that's what got you going. But once you're on insulin, who's managing the insulin? Who's prescribing it?
I would see an endo once every 3 months.
Okay. And that was just did you think that was just for the pregnancy, or did you know that was forever?
I thought it was just for the pregnancy.
Okay. There's always a lot of confusion here in these stories. Okay. So you believe yourself. Do you think then that you're type 2, or do you think that you're experiencing gestational once you're pregnant?
I'm thinking I'm type 2 at that point.
Okay.
My insulin needs obviously dropped off to next to nothing right after I had to be in the hospital. While we were still in the hospital, they were like, okay, well, we're going to give you 1 unit of insulin. I'm like, wait a second. I just had 80 units of insulin with breakfast yesterday. And then they put me, out of the hospital, they put me on metformin, which was a roller coaster because I had crazy GI effects with metformin.
Yeah.
I don't find out until a few years later that the one that they finally put me on that I could tolerate was the osmotic extended release version, which I find out later when I drive myself to the hospital with a high blood sugar because I stopped taking it cold turkey, which was a very bad thing. But I couldn't handle taking it because my insurance changed and would no longer cover the osmotic release or extended release. So they just gave me the different version without telling me. My pharmacy changed the prescription without telling me.
And you were once you started having the GI issues again, you're like, no, thank you.
Yes.
I see. And you are, well, let me get a tiny bit more background. How many kids do you have?
Sure. 2.
2. But that first one's about 10 years old?
Yep.
Okay. And then how old's the second?
2.5.
Oh, both girls, right?
Yep.
Okay. And okay, so you are using a ton of insulin during the pregnancy. You experience a drop in a need as soon as the pregnancy is over. Is that right?
Yep.
Okay. And then they put you on metformin because now they're treating you. Interesting. Okay. So then they put you on metformin. Is the metformin keeping your A1C down, or is it not really helping?
I'm kind of riding in the mid 6s.
Okay. Mid 6s.
For years.
For how many?
Probably well, they started experimenting with other things because the mid 6s that wasn't a good enough target.
Right.
So I'm like, okay, I'm eating good, decent. I'm not eating terribly. My portions are good. I'm not eating cake every day. I'm exercising regularly and I just can't lose weight. I'm doing everything that I'm doing should suggest that I should be losing weight. I can't lose weight. So we started experimenting.
Okay. Before you tell me about the experiment, the weight, did you have it before the pregnancy or did it come with the pregnancy?
I had it before the pregnancy. I started having issues with my weight around 2007 because that's when we actually found out I was diagnosed with Hashimoto's.
Oh, okay. Okay. Oh, and so nobody, all right, well, we'll get to that. So you had Hashimoto's 2007. Is it well regulated? Is your TSH under 2 or no? Today's episode is sponsored by Medtronic Diabetes, who is making life with diabetes easier with the MiniMed 780G system. The MiniMed 780G automated insulin delivery system anticipates, adjusts, and corrects every 5 minutes. Real-world results show people achieving up to 80% time in range with recommended settings without increasing lows. But of course, individual results may vary. The 780G works around the clock so you can focus on what matters. Have you heard about Medtronic's extended infusion set? It's the first and only infusion set labeled for up to a 7-day wear. This feature is repeatedly asked for, and Medtronic has delivered. 97% of people using the 780G reported that they could manage their diabetes without major disruptions of sleep. They felt more free to eat what they wanted, and they felt less stress with fewer alarms and alerts. You can't beat that. Learn more about how you can spend less time and effort managing your diabetes by visiting medtronicdiabetes.com/juicebox. Today's episode is sponsored by Medtronic Diabetes, who is making life with diabetes easier with the MiniMed 780G system. The MiniMed 780G automated insulin delivery system anticipates, adjusts, and corrects every 5 minutes. Real-world results show people achieving up to 80% time in range with recommended settings without increasing lows, but of course, individual results may vary. The 780G works around the clock so you can focus on what matters. Have you heard about Medtronic's extended infusion set? It's the first and only infusion set labeled for up to a 7-day wear. This feature is repeatedly asked for, and Medtronic has delivered. 97% of people using the 780G reported that they could manage their diabetes without major disruptions of sleep. They felt more free to eat what they wanted, and they felt less stress with fewer alarms and alerts. You can't beat that. Learn more about how you can spend less time and effort managing your diabetes by visiting medtronicdiabetes.com/juicebox.
Yes, currently I'm at 0.74,
Oh, good for you.
but that was a roller coaster as well.
Getting that straight was hard too.
Yes.
Yeah. There's a lot of things that doctors aren't sometimes very good at helping with, and thyroid can definitely be one of them.
Nope. As soon as they would get me within the acceptable range, I was basically accused as being fat and lazy.
Oh, so as soon as the TSH dropped, they were like, see, you haven't lost weight
5.5.
magically. You haven't lost weight magically, so you're not doing anything and you're eating poorly.
Correct.
Yeah, it's tough. Oh, I lost my train of thought. What were you going to tell me? Maybe you remember.
Experimenting with
Thank you.
different type 2 drugs.
Thank you.
I think I've tried like Invokana. That was like one massive yeast infection, like for a month straight.
Wait, I'm sorry. Are you using yeast infection as a euphemism, or you actually had a yeast infection?
Actually had one. See,
okay.
I'd never had one previously in my life, like ever, until I went on Invokana.
Because the reason I asked is because I've heard people say like dumpster fire, show, stuff like that. But I was like, is yeast infection a euphemism? I don't know.
No, show's basically my favorite one to use.
Okay.
So, yeah.
All right. Sorry. You have a month-long yeast infection. Sounds like a party. Do you know why? What about Invokana may or may not have had to do with that?
I don't know. But when I would Google, I would find that that was a common side effect for diabetics.
On that drug? Or just
on that drug?
Really? Okay.
Yep.
Huh.
We tried glimepiride, and I would drop really, really low. I would have lows.
Okay. So how long did you try that for?
Probably about a month or two.
So how long is this whole experimenting going on for?
I want to say straight through to about 2018. So like 4 or 5 years.
Mm-hmm. Okay.
I tried Victoza. Couldn't, again, GI issues. I really tried to stick it out, and I couldn't. I was like running to the bathroom at work. I would get sick and nauseous. It was terrible. And I was like, I just can't.
An honest to God show, you're saying?
An honest to God actual show.
Hey, I want to tell you, I have a little bit of information here before we move forward. Invokana the mechanism of Invokana, while effective in controlling blood sugar, also leads to increased risk of yeast infection in diabetics for several reasons. Increased glucose in the urine, moist environment. I don't want to read this, but I'm going to. The presence of glucose in the urine can contribute to a warm and moist environment in the genital area, which is conducive to yeast growth. Sorry about for that one. Diabetic vulnerability. People with diabetes are already at a higher risk for infections. Altered microbiome. The altered glucose levels can disrupt the balance of the normal microbiome in the genital area, allowing yeast to proliferate. Well, live with that thought, everybody. Wait, does that mean there's little bugs in your... Now, let's not talk about that. Okay, sorry. Oh, Jesus Christ.
Omar.
Yeah. All right. Okay, sorry. You know, it's so funny. Like, I reached out to you. I'm like, do you want to tell your story about glucagon? And you're like, yes. But then you sent me this list. You're like, I'm a episode on my own. And I was like, oh, okay.
Well, like a recurring guest, seriously, because I actually did a full like write up because I was just trying to like write down my whole history, and it was like 5 pages long. So you got a very shortened list of what truly is my show of a journey.
You're gonna be like somebody who just comes on every 6 months and they're like, okay, where were we? And this happened. All right, so then you go to, what was the next one you tried?
I think we were just back on metformin at that point, because that was so we did the experimenting, and then we had the metformin, and then I had the episodes of where I stopped taking the metformin when they switched the dose. And I was actually at an amusement park one day and ended up in their like medical area, first aid area. I was testing because I only had a meter at that point, testing my blood sugar, and it was just reading high. So I think that meant like my blood sugar was over 500.
Mm-hmm.
The person in the first aid area just told me to drink a lot of water.
Well,
and I'm like, okay. So I did that, and it gradually came to, walking around in the amusement park with the exercise eventually brought me down, I guess.
Mm-hmm.
But I'm actually questioning whether or not that may have been like DKA. Not sure.
I mean, it's, it depends on how long. DKA can come on very quickly. It could actually can happen without enough insulin, even with an in-range blood sugar. So
right,
yeah,
which I've learned from the podcast.
Oh, sorry. I just drop in these little things as we're talking. Do you think sometimes people are like, I've heard him say that before? And I was like, yeah, but everybody hasn't heard me say it. So I'll slip that stuff in. Okay, so you're wandering around this park on just metformin.
That's when I stopped taking metformin. There's like a week stretch of where I stopped taking it.
You're like, I'm stopping this and I'm riding a roller coaster.
Pretty much. It was a roller coaster indeed.
Me and my moist genital area are going to go to the Six Flags. Jesus Christ. Do you feel crazy at this point? Like, it's a number of years into it now, and this is just like people really have to step back when they listen to this and recognize that the span of time and days in your life that go by with all this inconsistent information and unknown like outcomes that are happening all the time. Like, does it just eventually get to you? Do you just think I'm just a sick person?
I never really felt that way. My husband was like, okay, you suck. Like, you're always sick. And I'm like, you're just generalizing. I'm not always sick. When you're in it, you don't realize how long it truly is. But when we finally get to the end, and I look back, like, I'm feeling all the feels, because I am just pissed off at this point that people have literally f***ed with my life for the last 10 years.
Yeah, it's a decade. And to your husband's point, like, it feels like you go to the store and there's like 50 boxes there and you somehow grab the one that's missing a part. Like, there were so many girls. Like, how'd I get this one? But no, seriously, it's important to bring up, because I believe that while you're going through all this, sometimes the person going through it is the last one to really see it. And it does impact the people around you. And then, finally you have this reckoning where you understand fully what's happened to you. And you got to have a really good attitude not to feel like somebody stole something from you, Well,
you go through the range, like the stages of grief almost, for the years that you've lost.
Mm-hmm.
Rage, you're sad, you're depressed, you're whatever. But then I am way too much of a take charge person. And obviously, my kids, they put everything into perspective and give you something to like, well, I may have lost this time with you before, but we're going to make the best of everything now.
I try to remember too that all of the things that I figure out about my health could likely help my kids one day, and then they won't have to waste that time. That makes me feel better about it sometimes.
Absolutely.
Yeah.
And then any stories that we can share. Like, this is part of the reason why I wanted to come on and share, is that somebody listening somewhere hopefully will think a little bit more about advocating for themselves to get what they need to get.
Yeah. We're going to reduce moist genitals everywhere with this conversation today. Also, I think we're going to save some people's asses when you talk about your what happened with your glucagon. But okay, so anyway, we get through all this time, and you continue to live the way it goes. What gets you to somebody saying, "Hey, you have type 1 diabetes"?
real quick, I want to back up for a very quick story because we're not there yet.
Oh, okay.
We get to a point of where Trulicity. So I start Trulicity. That actually was very helpful. I also get to a point of where I'm like, okay, I'm done with this. I felt like I had better controlled blood sugars while I was pregnant using actual injectable insulin. So I basically bully my endo to give me insulin so I can just do it on my own. Mm-hmm. I do get much better control there, but I still end up having crazy lows. Again, still not fully understanding how insulin works. The big one for me, I think, was fat and protein and how that really affects insulin, because I would do all of my dosing up front and be like, what the hell just happened?
Yeah. You'd crash.
I would crash.
Yeah.
I was like, okay. So my husband sees the Dexcom Super Bowl commercial for the G6.
Really?
With Joe Jonas. And he's like, you need to get one of those. And I said, oh my gosh, that is exactly what I need so that I can prove to my doctor that she has me on too much freaking insulin.
Can I say something before you go on?
Sure.
When Dexcom put Nick Jonas. Nick, right?
Nick. Yeah, Nick. Sorry.
Everyone's like, you don't know it's Nick. I'm like, I don't really. When they put Nick Jonas in that Super Bowl commercial, I heard so many people bitching, right? They're spending all that money. That's why these things are so expensive. You don't have to do that, blah, blah, blah. And this also came very much from the, I don't want to just say the Instagram crowd, but like there's that age range. You know what I mean? When you're like 26, you think you understand everything. Sorry for 26-year-olds. Like you have big ideas about things and sometimes you don't recognize there's other things you still haven't learned about life, and you make these big pronouncements. I saw a lot of these big pronouncements from people of a certain age. This is a waste of money, blah, blah, blah. Like, first of all, $1 million is a lot of money for a commercial. I don't actually know what Dexcom spent on it, but let me just say this, like in the grand scheme of things, it's not that much money. So like if they took the $1 million and split it up amongst all of you, you'd all get about 46 cents. So just calm down. It wouldn't make everything, 50% cheaper. Nevertheless, that goddamn commercial saved Tiffany, and how many other people who are like, just because you know about it doesn't mean everybody knows about it. And so you got to get out there in the public and show people. And that was, a bold thing to do. It's so funny because like we complain that diabetes companies don't do enough. They don't do enough. And then one company's like, you know what? Let's reach down deep in our pocket and buy a Super Bowl ad. And then they do it. And then people complain about that. I just love watching people complain. Nevertheless.
Well, I feel it's the human condition, right? People are not like content with life unless they're bitching about something.
Apparently. Also, a little bit of your Philly accent came out a minute ago. I appreciated that.
Oh, thanks.
Yeah. Are you from here originally or just Pennsylvania in general?
Pennsylvania in general. But it's funny because my older daughter, when she was in daycare, they're like, do you have family in New Jersey? Your daughter has this accent, which is a perfect blend of like Pennsylvania Dutch and New Jersey.
Yeah, no kidding. My grandmother was Pennsylvania Dutch, and she spoke out of order. And I've never, the best way I can ever explain it to people is that if there was a cow on the other side of a fence and she was on this side of the fence and she had to throw hay to the cow, she'd say, throw the cow over the fence some hay.
Yeah, I think it's just like the bastardized German, because that's basically what Pennsylvania Dutch is.
Yeah.
And it's just the order of their like adjectives and verbs.
Yeah. Anyway, I just heard a little bit of like, you almost sounded like an actress who was told they were going to be in a movie that was set in Eastern Pennsylvania. It was fantastic.
Nice.
I'm so sorry. Anyway, the Super Bowl commercial, let's assume it's the year that the Eagles killed the New England Patriots and embarrassed Tom Brady, and then move on. So you saw that commercial and then what happened?
So I reach out to my doctor, who has to do this like huge justification for my insurance company because I'm type 2. But we get that taken care of. And I'm like, yes, finally, things are coming together. I have my insulin. I can micromanage the hell out of my diabetes now because I'm a data junkie too. So now I'm like, I'm going to have all of this data. It's going to be great. 2 months later, I get pregnant.
Well, so you were really managing your A1C, and your body loves being pregnant when your blood sugar's not high, apparently. So
apparently, but that kind of I'm like, yay, this is super happy, and it was planned, and we loved it, and it was fabulous. but it was going to basically f with me proving my doctor wrong.
Oh,
So,
you're like, but I need this insulin. I want this
no,
insulin.
like I need to prove her wrong. I
Yeah.
need to prove her wrong. So now we're, riding the pregnancy wave yet again. Crazy, crazy amounts of insulin. I do okay for the most part. I do. It's a totally different ball game wearing a Dexcom when you're pregnant versus just testing your blood sugar. And I'm like, wow, you go low, like a lot. Like, especially when your older daughter's favorite meal is fettuccine Alfredo.
Yeah. It teaches you a lot being able to see your blood sugar like that in real time. I think, honestly, everybody would benefit from seeing their blood sugar a couple of times.
I think, like, anybody who is diagnosed as diabetes should have a CGM. Like,
At no point did anyone say you have Hashimoto's, that's an autoimmune issue. I wonder if you're type 1.
Not a doctor.
Oh, okay.
And now I've seen at least 3 different endos at the same practice now.
I just want to brag for a second. If I talked to you then, I would have figured out you were type 1 in 8 minutes. That's that in the beginning of the episode. I would have been like, wait, no, you probably have type 1. Yeah, okay.
So fast forward through the whole pregnancy, again, go off. Well, not that insulin needs reduce after my second daughter's born. She does almost try to kill me on the way out. So that was fun too.
Did she grab onto something? What happened?
Well, maybe because I was hemorrhaging.
Oh my God. Mom, we should bring this kidney with us. I don't know.
Yeah, like we need extra parts on the outside.
I, by the way, don't know how the body works. If I just assume you can grab everything while you're in there, but go ahead.
Who knows?
I'm sure someone knows.
Yeah,
Tiffany.
I almost pass out, because they always try to give you the baby like right away when they're first born.
Yeah.
And yeah, it's all fun and great. And then you kind of have this superpower of where you don't feel pain. Yeah, not me. They put her on my chest and I was like, yeah, no.
Not yet.
No, I can't. Well, I felt myself slipping.
Okay.
And this is valid because later when we talk about Gvoke, I was as close to feeling like I was going to die when I was having her as I ever did. And I just heard a voice in my head say, you can't give up. If you give up, you'll die.
Really?
Mm-hmm.
Jeez, from the hemorrhaging.
So my epidural didn't work.
Oh.
And I had, the contractions they induced her. She wouldn't come out. They tried absolutely everything. I was going through during COVID. So the only person there with me was my husband. So no real support. I mean, I love my husband, but
Tiffany's like, he was
he's
done
the one
after,
that did this to me.
Yeah, right after he got me pregnant. I didn't really hear from him again. He didn't have a lot to do.
So I do love him dearly. They were to the point of where they were going to give me laughing gas. And then they're like, well, we can do this. But then I tell him, you need to get that doctor. I'm ready to push. And he is like, no, you're not. She just said you're not ready. And I'm like, I'm telling you, I'm ready. Because unless you've physically had a child before, there's just this, your body just knows when it's time. And she came back over and I think I dilated from 7 to 10 inches in 5 minutes.
Wow.
So that was real fun. But anyway, but that feeling, that voice in your head of you cannot give up, you will die. If you give up was again the closest I ever felt to coming that I was going to die. Second would have been the Gvoke episode. But anyway, after I have her, my blood sugars, believe it or not, are terrible. I was riding in the 250 to 300s. Oh, I don't know, for probably about 3 months. It pushed my A1C to a 9.4.
Mm-hmm.
And there was no, I would ask, I'd be like, what is happening? Why is this so high? I also had crazy, terrible inflammation in my hands to the point of where I was even having trouble picking my baby up. The answer for that was steroid injections.
People are like, you seem like you're hard on doctors. I'm like, well, have someone come on and tell a story that doesn't make it sound like nobody's doing anything.
Mm-hmm.
What I wonder is, I see this happen sometimes in complex medical situations, which yours is, because the timing around the pregnancy confuses people. The oral medication seems to help, which confuses people. I get all that. But sometimes I think it's because they know the whole story that they're confused. If you just went to a new person on that day and said, I needed insulin, I got pregnant, the pregnancy ended, and I just need like my blood sugars are 250 constantly. By the way, I have Hashimoto's. A new set of eyes would have went, well, yay, it sounds like you have type 1 diabetes.
So now you'll find out how I got there.
Okay.
So daughter number 1 decides that, like, hey, let's be a Girl Scout. So we sign up, and I am, again, super type A. I become the cookie mom. So that means I'm going to be in charge of all of the ordering of the Girl Scout cookies for our entire troop. So through this, I run into another Girl Scout mom who essentially has the cookie cupboard at her house. So every week, my troop says, hey, this is how many more cookies we need. I go to the cookie cupboard to get the cookies for our troop. It's funny because just in normal, like 15-minute conversation, picking up cookies each week, we get into a conversation about thyroid. And she tells me that her daughter was recently diagnosed as type 1. So this conversation is happening in April of 2022.
Mm-hmm.
So her daughter was diagnosed in October, and she's like, oh, I listened to this podcast while I walk. It's great. So she starts telling me about the podcast. And then the next week, she's walking by, dropping off some cookies for me. And she says, hey, I'm going to send you a link. There's this article about LADA. So the latent autoimmune diabetes in adults. And she's like, I think that you may actually be type 1. I read the article, and she's like, these are the 2 blood tests that you need to ask your daughter for, or your doctor for.
Yeah.
So I send a message in the portal to my doctor. And at this point, I'm like, I know that I need a new doctor, but I also need my prescriptions at this point. So I was just like, whatever, she can still send in my prescriptions. And I try to message through the portal because their office just sucks. I mean, you can call, they lose messages. It's a complete show.
Mm-hmm.
So I message to the portal and say, hey, I'm wondering if I might not have LADA. Can we run these 2 blood tests for my next appointment? And she says, yeah, sure. So she sends them. We're on vacation in July. I look at the blood test results because I do my blood work right before we go on vacation. I'm looking at the results in the portal, and I immediately Google, right? Because I'm going to Google diagnosed myself to see like what the ranges were. And I'm like, oh, holy shit, I have type 1.
Yeah.
And it was kind of like, it was almost like a relief in a way.
Sure.
Little did I know what I was getting myself into, but I was like, at least I might have some sort of an answer now.
You know, there's a hint in your story when the Trulicity helps that you might be type 1 as well, because you're seeing now a lot of type 1s on GLPs need significantly less insulin. And if you were at the beginning of a lot of diagnosis and a GLP suddenly brought your needs down, that doesn't surprise me at all. I did you hear Jim's episode like last week?
I didn't hear his yet, but I did listen to the first Dr. Blevins episode.
Yeah. Jim is a 58-year-old type 1 who most likely has either a really slow onset or moody or something like that. But nevertheless, he was on insulin for 6 years, like heavy use of insulin for 6 years. He started using Mounjaro, and he's like completely off of insulin right now. And like, that's insane. But that's when you said the Trulicity was helpful, I thought, oh, that makes sense to me.
Mm-hmm.
Okay, so you Dr. Google yourself up. By the way, you've definitely called this episode probably the Cookie Mom or Cookie Mom.
Cookie Mom.
Would have really helped if you would have said the cookies were moist, but I don't want to pin you down on the details because then we would have had some double entendre going, which would have really been lovely. But nevertheless, but so you figure this out for yourself. Does the doctor bite or does she push back?
So she argued with me. I have my doctor's appointment. Interestingly enough, the same day I have an ablation done because
for your heart?
Also, no, my uterus.
Oh, uterine. Okay, sorry. That I think my father-in-law just had to have an ablation, which made me think heart. But you got the lady parts lasered?
I did get the lady parts lasered after my cycles started up after my second daughter. I had a crazy periods with super crazy bleeding.
Mm-hmm.
That I was like, I thought I was dying at one point. I was like, I'm like, there is no possible way this much blood should be coming out of me. So I have the ablation done.
Is there anybody who wants to be a girl after they hear stuff like this?
No. They just turn away. So I'm like still hopped up on some of the drugs that they give you for the ablation process. I have a video appointment with my endo at this point, and she gets through the entire appointment and she's like, okay. And I was like, well, hold on a second. What about those like blood tests that we did? And she's like stuttering, at this point, she just didn't even look at the results and forgot that she added them to my blood work. And then she's like, she actually got an attitude with me. And she's like, well, what do you want? Do you want to go on an insulin pump?
I would like you to just like be reasonably competent if you don't mind.
Like you to do your damn job. Yeah. That's what I would like. So,
how much of college did you drink your way through, lady?
My gosh. Well, see, you get degrees, right?
Oh my God.
There are people that suck in every profession.
Sure.
So I get off the phone and I am like livid, and my poor husband is getting an earful because I'm just venting. Like, I don't even know what to do with the rage that is currently inside me. 20 minutes later, I get a phone call. The doctor's calling me back, apologizing to me.
Oh, finally.
Stuttering, like stammering, like, I just don't know. Yeah, I didn't realize you had all of this blood work done at the same time. I'm like, oh, really? Because I can see it in the portal and it's time stamped. They're all the same day. Like, seriously.
I forgot to do my job, but I just did it now when I hang up the phone, and we got to get you some insulin.
Right. Yeah. Well, and I'm still on. I'm on injectable insulin at this point. Right.
We're gonna get you some more.
I'm dosing myself. So. Anyway, she's like, oh, well, do you want to go on a pump? She goes, do you have any idea what pump you want? And of course, because I diagnosed myself 2 weeks ago, I see all about Omnipod 5 that's coming out. And I'm like, yeah, I want this one because my toddler, I love her, but she is basically trying to kill me every other day. The last thing I need is tubes for her to yank on and pull. So I'm like, yes, I would like a tubeless pump. And I was lucky enough to kind of beat the rush and got my starter kit like right as it hit mass market.
Oh, wow. You hit that kind of sweet spot in there. That's interesting. Mm-hmm. Good. Yeah. Well, I mean, the kid grabbed onto your fallopian tube. She was definitely going to pull out your tubing.
She was definitely going to pull out that tubing.
Yeah, I gotcha.
So obviously I get with an educator who like is all excited about me. I was only like the second person she was going to be training on Omnipod 5. But the problem is that my settings that the doctor was going to put in there were based on crap to begin with. Mm-hmm. So the educator actually sat down with me to help me try to figure out a starting point for settings to put in that were way different than what the doctor was going to suggest.
Right.
So, but it's still a roller coaster because like anytime you start that, it's just a starting point. And then you have to basically correct like the hell out of it so that it learns, okay, we need to be better. So basically at that point, right? So I was at a 9.4 A1C. Once I get the insulin pump, the Omnipod 5, and obsessively listen to the podcast. I'm like cooking dinner, like driving anywhere, like not listening to my family when they're talking to me, just like trying to ingest as much as I possibly can of the podcast. I, by October, have my A1C down to a 6.0.
Oh my gosh. Oh, I wish you wouldn't have gotten the ablation because I think the next kid could have been named after me, but that's okay. I want you to be happy, I guess. But wow, good for you. Hey, that's wonderful. Must have felt like such an accomplishment too after all that time.
Well, it was. And then I'm like, I'm her star patient. But I go through some other hurdles, right? Because at this point, like I am just starting an insulin pump. So, and I have to switch the vials. I don't have enough of a supply. So when she starts to go sideways, I'm kind of screwed. Mm-hmm. So I ended up on more than one phone call with the office manager at my office or at my practice, yelling at them, basically saying, because nobody told me what do I do when I don't have a pump or in the event of an equipment failure? Because why would we have sick day protocol? Why would we teach people what to do if their pump doesn't work or if they run out of supplies? Why would we do any of that? It would like put them out of business, I guess. I don't know. But
we don't want to let you know how to take care of yourself because then you wouldn't have to call here. And then we couldn't give you no help. Then you come in, you give us $40. This is really the goal. We need the $40. And
we need the $40. Yeah. So, and I also yelled at a pharmacist too because they were short-staffed, and because it was during like all the COVID injections and everything, and they were making the pharmacists, which I do get, they are making pharmacists do way more than what they had the capacity to do.
Sure.
But somebody screwed up my insulin vial like prescription, and they gave me a partial at one point. And when I went back in for more, they were like, "No, we already gave that to you." And I'm like, "Well, no, you didn't, and I need insulin." And I think I made the pharmacist cry when I was like, "It's not like
Christ.
this is fucking Viagra and I'm trying to get a hard on. I need it to fucking live." Needless to say, I walked out of the pharmacy with my insulin, and that pharmacy is no longer in business.
Really?
I'd like to think that I had a little bit to do with that. Maybe I did, maybe I didn't.
Wait, a pharmacy went out of business?
Yes.
Oh, when all their employees had to go get like long-term therapy because of you. Is that what happened?
Yes.
They were like, we're admitting a lot of our staff for psychiatric care, so we can't keep going. Was it just bad? They just didn't do a good job?
Well, no, and they didn't, and then they were so rude. I mean, you would have to wait almost an hour in line just to pick up your prescription, and you couldn't call because they wouldn't pick up the damn phone. And like, I guarantee you, they had this like security cam footage, like photo of me hanging up behind the counter. That was just like, give this woman whatever she needs.
You're probably
like,
on a t-shirt. You're probably on a t-shirt that they handed out at the Christmas party. Oh my God.
Probably.
Well, listen, you're frustrated, right? And then there's all
Yes.
that, I mean, the COVID anxiety on top of everything else. And you're just figuring this thing out. Also, I would listen, if we're going to be realistic, you spent almost a decade trying to get an answer for yourself, and now you have it, and you look up and the next person in line's giving you a problem.
Yes.
It feels like it's never going to stop. You know?
And I'm done at this point
Right.
because I'm like, I am not going to mess with anybody getting in my way anymore.
How long ago was this?
So this was probably the end of 2023.
Okay, so pretty recently. Hey, listen, before we move on, because we're going to jump ahead to your low blood sugar and something, but I just want to let you know that at the end of my notes here about when you asked about when we were talking about the other drugs, it says one of the tips it gives to avoid a yeast infection is to avoid tight-fitting underwear and to opt for breathable fabrics like cotton. So I understand the breathable fabrics part, but between you and me, I've never worn underwear as a lady. What is loose-fitting underwear if you're a woman?
I guess I'm supposed to identify as a guy and wear boxers.
I mean, because I get guys wear boxers sometimes, and so when you say loose-fitting to a guy, it means that it's like not hammocking your business, right? Like,
right.
But when you got lady business, isn't it all sort of pretty like streamlined?
Yeah. Like, there really is only one kind. I mean, even the boy shorts for women
They're still
hugging the junk. Yes.
But like everywhere that women's underwear is touching you, everywhere that women's underwear has fabric is touching you, right?
Yes.
What the hell would loose-fitting women's underwear be?
I don't know.
That's all I got here for you on that one. I just wanted to break up the story so that we could go to something else and let everybody think for a minute. What does it mean, loose-fitting women's underwear? I don't understand at all. Because it just sounds like baggy in the crotch, right?
Yeah. Well, that's what it would have to be.
All right. It doesn't make any sense to me.
Maybe I should Google that later. Maybe that's another Google thing.
I have to tell you, I thought for a minute when you were coming on today, like I was like, maybe I'll ask Chivoke if they want to sponsor this episode because it's going to be, and now I realize I'm not going to be asking them that at all. They won't be using this episode on their website. That's for certain.
I warned you. No, I do believe I warned you.
It's fine. Don't worry about it.
So super tight control, right? At this point, I'm basically just using my doctor as a drug mule for the prescriptions. It's great. I'm using the podcast. I've listened to the pro tip series, Defining Diabetes. Holy shit, variables was like a goddamn life changer. Like, who knew that your insulin needs can increase like 3 times the actual amount that you usually use, during your period? Like, crazy.
We just talked about adding to that series recently, to the variables series. So you're out there in Pennsylvania, middle of Pennsylvania. I'm your doctor through a podcast, me and Jenny. Is that basically how you're managing this?
Yes. A Girl Scout cookie mom diagnosed me, and you're my doctor.
Yeah, there you go. Life's fair.
And your nice little disclaimer, hey, don't try any of this stuff. I'm not actually a medical professional. I was like, well, I mean, obviously he knows what he's talking about. So we'll give it a try.
Obviously.
What could happen?
Yeah, how could this go wrong? He seems very worried about what loose underwear means, but I'm going to listen to him about this pre-bolus ID he's got. That's ridiculous. I'm never going to stop being bowled over that this podcast is popular because it shouldn't need to be. You know what I mean?
It shouldn't need.
Right.
This should all be stuff that is given. This should be basic information given to patients when they're diagnosed. But it's not. And that's the problem. Like, there are good doctors, but most of them suck. Maybe in another episode, we talk about how a rabbit in my backyard led me to a new endo who I absolutely love. And she loves me and we're great. We have a wonderful relationship.
Hey, rabbit in your backyard, that's not a euphemism, is it?
No.
Okay, there was actually a rabbit in your property.
There's actually a story.
Okay.
Yes, it's a rabbit. Dogs are involved. There's 3 ER trips. Yeah, it's fun.
I once heard a lady go, woo, I got a rabbit in my backyard. And I didn't know if it meant the same thing.
Wow. No. So anyway, I learn through the podcast basically everything I know. Variables, the timing and effect of insulin, the fact that I should be walking around with a rescue pen wherever I go, because, even if you are super well controlled, shit still can happen.
Yeah.
Leads me to my Gvoke story now that we've been chatting for an hour.
So let me just say this up front. I want all of this credit to fall right on me. You are carrying Gvoke HypoPen because of the Juicebox podcast.
1000%.
Okay. What happened?
So I get to work, normal day at work, right? I sit down, I'm turning on my monitors and like everything kind of looks a little bit dark in my office, which I'm like, oh, well, the sun's shining in. So you know how you get like that sun blindness, so where it kind of messes with your vision for a little bit. And I'm like, oh, well, we'll just, chit chat on the phone here a little bit as I start my day until the sun goes down enough for me to be able to see my monitors because I was too lazy to get up and pull down the shades. Having a little bit of trouble concentrating because I'm on the phone talking to somebody, but at the same time working, which I multitask, but I'm having trouble doing even one of those things. And I'm like, what the heck is going on? And then I start to see the bigger spots floating around in my vision. And I'm like, oh no, that can't be right. What's going on? Look down at my Dexcom. At this point, I'm like, it's 104 double arrow down. The 104 is kind of irrelevant because I would expect to be right around that amount. But I'm like, the double arrow down makes 0 sense. I have only dosed for my coffee at this point, which I usually throw an extra 5 carbs because the coffee hits me even if it's black. So I'm like, but I didn't, it's not like I ran up a flight of steps or, did anything. I literally sat down in my chair at work. Few minutes later, drinking my coffee, going on about my day.
As you would have any other day.
As I would have any other day.
Okay.
And then I really start to just like, the vision is just going more and more. And I'm like, holy crap. I look back again, not even 5-10 minutes later. Now I'm at 64, straight arrow down. And I'm like, uh-oh. So I text my husband and I'm like, because he follows me on Dexcom. And I was like, there's some crazy shit going on with my blood sugar. Just wanted to give you a heads up. I'm working on it. So this is just in a text, right?
Yeah.
So I'm still on the phone with my friend at this time who knows I'm type 1 and she's forever been my don't die buddy, right? She knows, she could tell by the color of my cheeks if my blood sugar is low. So I test my blood sugar because I was like, is my Dexcom really that off? I don't think it's off. I mean, the arrow's right, but the number seems off for the symptoms that I'm having because I am also hypo unaware.
Oh, okay. You don't feel lows at all?
I don't feel lows.
Okay.
Spots usually are what I see. And by the time I see those spots, I'm in the 50s.
Okay. The 2 arrows didn't scare you? Or were you already kind of out of it?
But it all happened so quick because it was rapidly falling. So I pull out my Contour Next One which I also got through the Juicebox.
Contournext.com/juicebox. Go ahead.
So then I tested and I'm 36.
Ooh. Uh-oh.
Mm-hmm.
And are you out of it at that point, or are you cognizant enough to go, I'm in trouble?
No, I knew I was in trouble, but it still didn't really register because I'm stubborn and I like to not, I was in denial, basically. So I tell my friend, I was like, okay, I need to call my husband quick. Like, this is bad.
Do you know why? Why did you think to call somebody? Like, why not eat something?
Because I was too nauseous. So
okay.
There were like 9 million thoughts going through my head at the same time.
Yeah.
Because my brain was still fully functional. I just didn't have my faculties.
Yeah, that's what I'm I want to make sure you get that across to people. Like, it's not like you're altered. You just kind of half don't realize it. So you're following whatever your common sense at that moment is telling you. Is that right?
Right.
Okay.
So the very first thing I do when I see I'm 36 is I pick up my Omnipod controller and I'm like, oh, I have 4 units on board. And I was super nauseous by that point because I had dropped so quickly that I knew, like, juice is like my go-to.
Mm-hmm.
I knew there was no way I was keeping that juice down. So at this point, I know that I have to use my Gvoke, which obviously I've never used before. And I'm like, I really hope this works.
This guy on the podcast talked me into getting this, and let's see what happens.
Yep. Now my life is literally in his hands.
I only live if a boy named Scott who knew how to buy a microphone was right about something called glucagon. Let's go.
Dude, I'm not even kidding, because it kind of gets worse because so I hang up with my friend to call my husband quick, which seemed like it took me 30 minutes to do because I am focusing every ounce of my being. Like, I've had an iPhone for years, right?
Mm-hmm.
And I'm like, and they're both in my favorites. And I'm like, okay, hang up, press. I had 2 buttons to push. And it was all I could do to push those 2 buttons. And what finally kind of snaps me into action is my husband yells to somebody that he works with, like, dude, you just got to hold on a minute. My wife's on the phone. She's crying, which I like never do.
Mm-hmm. She's
having a diabetic emergency. And then for whatever reason, that is what snaps me into like, oh, this is really happening.
So you contacted him without really even knowing you pushed the buttons. And then you kind of like come to him yelling. Is that the idea?
Well, no. I'm still conscious at this point.
Yeah, but I mean, like, I know you're conscious, but like your focus, your understanding, is it fading in and out, or do you not even remember?
Yes.
It is.
Yeah,
okay.
Because, and I didn't even realize, to me, it wasn't at the time, but like my friend told me after the fact, she goes, I was asking you if you had juice and you were never even answering me. Because I don't ever remember hearing her. Because while I never pass out, I am like essentially in and out of consciousness.
Yeah.
I managed to call her back, but while I was on the phone with my husband, she had called somebody that I work with who was physically in the building because we're working a hybrid work schedule. So that building is very like sparsely populated on any given day. So luckily, she has somebody come to my office and she's like, what do you need? Now, the Gvoke, I mean, it has picture instructions on the actual package.
Right.
I have told people how to use this thing no fewer than 100 times. Because like anytime we're out or doing something active, like I will actually show people, like if it's a different, group of people, be like, hey, if I drop over, like, here's this thing, super easy to do, like an EpiPen, like just like follow the instructions. But for the love of God, just don't take my pants off.
And if you want to yell clear for fun, you can, but it's not necessary.
Well, because the package has like the little dude, like he's naked in the picture. And I'm like, you do not need to strip all of my clothes off.
Just find a little skin, please. Doesn't need to be all of it. I have to stop you and apologize. When your friend said I was asking you to drink juice and you weren't responding, I started to cry because made me think of when this happened to Arden. And I was on the phone with her and there was this moment when she stopped responding and I knew what was happening. And it's maybe the worst feeling I've ever had in my life. So it just rushed over me. Sorry.
Yeah, I can
apologize.
imagine from a parent's perspective, because that is one thing, like out of anybody, like I am so glad that this was me and not my kids, because I do not know that I would be able to handle my kids having a diagnosis. Because it's a different world.
It sounds like you'd be okay. You've been through enough stuff, but I'm sorry. Go ahead.
Probably. It's okay. So So I have a friend on the phone. I have a friend in my office. I am able to tear the package open and pull the pen out. But then I look at the friend who's physically with me and I say, now what? Because I was stopping. I had to be like literal single digit minutes away from passing out.
Yeah.
So we do the injection. It burns a little. It's not terrible. But then we're sitting there because now I'm like, so other friend on the phone is Googling the shit out of this. So she's like, how long is it going to take to work? What do we need? What do we need to do? And at this point, like, because I also need to replace my pod at some point. But I'm just like, no, I have to leave the pod on because like, I don't know how high I might shoot up after I take this. Like all unknowns, right? But I would say within 15 minutes, I think I was up from now. And my Dexcom never alarmed, never alerted. I didn't get the fall rate alarm because I think it just happened so quickly that it didn't even like give the alerts. Okay. So I think maybe within like 15 minutes, I might have been around like 70.
Okay.
And then I was like, once I hit 70, I was like, okay, we're turning around. This is good.
Right.
But then like after the fact, I'm on the phone with my friend and she's like, how do we do this like better next time? What do we do? I need to react faster. You need to do this. So we were just doing this whole like debrief of what just happened. Because I will also say, until I listened to the podcast, I look back like over the years of using insulin and I actually realized how many times I was very close to a seizure and or dying.
You just didn't know about it.
And I just didn't even know.
Yeah.
And this time, it wasn't quite as bad as when I was in the hospital with my daughter, but this was a very close second to if somebody would not, like if I wouldn't have had Gvoke and people there with me to help me with that, I pass out. Nobody even comes looking for me for at least 30 minutes and I die.
Yeah.
On the floor in my office.
Nobody wants to die at work, that's for sure.
So the biggest message in like all of this that I would have for people is it does not matter how much you think you have your shit together, how good your A1C is, how good your control is. It can happen to anybody.
Mm-hmm. No, it doesn't have to be a lot of insulin. It doesn't have, you can just have these random confluence of events. And the next thing you know, you're in a situation that you have to act in. And, it's funny because I would bet that if this happened to you again, exactly this way, spots in your eyes, too nauseous to eat, you'd go right to the glucagon next time, I imagine.
Yep.
Yeah.
Yeah. Because I was kind of not seeing what was happening. But yeah, from the second I get those spots, and that's the scary part of being, hypo unaware, not knowing or feeling those lows, is the second that you have one that you do notice, you need to act immediately.
You're farther gone than you think you are at that point.
Yes.
Yeah.
And depending on how quickly, I've had that happen in the past, but I've been able to, juice or, fast acting carbs my way out of it.
It's interesting too to watch you go to like the steps, like I'll call my husband so he doesn't worry, which, you know, you look back on now and you're like, that wasn't important to do. And, just like.
But I think it was because it's like him having the reaction that he did is what kind of snapped me back awake,
you did
more or less.
Oh, yeah. That definitely got you lucky. Yeah, boy, isn't it crazy? Like you can like Monday morning quarterback this stuff to death if you want, but it's going to be different for everybody. The situations are going to be different. Mm-hmm. If you would have decided on that coffee 20 minutes before you got into work, you could have been in the parking lot in your car while this was happening.
Or driving on the road on my way to work.
Yeah. So
over a large body of water.
Lake Erie?
Not quite. Oh. No.
Not that big. Wait, Erie, Pennsylvania is not where Lake Erie is it?
Yeah.
Oh, it would make sense though.
Erie is like borders Lake Erie, but that's in the northwestern part of the state.
That's neither here nor there. Okay. So then I have a question. The next day, first of all, do you go back to work or do you go home?
No, I stay there and finish my day because if I'm going to take off work, I want it to be for something fun.
That's how you got a good employee right there. You're like, yeah, I almost died, but things are good now. Let's get back to it. Jeez.
I hope my boss listens to this podcast.
Well, yeah, no kidding. It's worth a raise, I think, or at least a shout out at an event or something. The rest of you who are hiding in the bathroom, I know you're hiding in there. This lady just almost had a seizure and she's still working. Next day, is the next day a work day?
Next day is a work day.
Did you bolus for your coffee?
I do bolus for my coffee.
Mm-hmm. And why? Tell people why you did.
Because my sugar's going to go high if I don't.
Okay, good. But do you have any idea what happened that day for that low blood sugar incident? Do you have any idea, like in hindsight, what went wrong?
I think it's a combination. It was iced coffee and not hot coffee, which I tend to sip like slower. Okay. Or like the hot coffee, you've got to drink it before it gets cold. So you tend to drink it faster. And my pump was on the last day, like already expired. So I'm in the 8-hour bonus window at this point. Mm-hmm. And there, from swimming and everything over the weekend, I think there was some condensation in the window and just kind of like pod placement of where my cannula may or may not have bounced out a few times. I think there was a little bit of extra insulin in the window. And when I bolused for my coffee, it leaked in.
That seems less likely, but I like the other thing about the drinking pace, because you may
definitely the pace.
Yeah, because you have it worked out. I put the insulin in, I drink the coffee like this. The coffee hits me hard. It battles with the insulin. I stay nice and stable. And then you put the insulin in, basically didn't consume the coffee the same way. The insulin got ahead of you. Because I do think it's possible that 104.2 down that goes to the 64.1 down, but it's not reading fast enough. Like maybe that is a little bit of the coffee trying to help, but being overwhelmed by the bolus, if that makes sense.
Yep.
Yeah. Otherwise, man, that's scary. Wow. And then how do I end up knowing about this?
So I immediately want to go out to the Facebook page because that's like, these are my people, right? Anytime I'm panicked or I have something that I don't know how to do something in this area. Or if I have a question, it's like you go to the group, you search other posts, or you just do a post and say, hey, has anybody had experience with this? Because doctors at this point can doctor you to a point. The people who live with this disease in and out every day are going to be a better resource than anybody. So I'm like, dude, this is crazy, but I feel this need to post this story for people because I believe that anyone who's using insulin should have a Gvoke or another equivalent to rescue them in a situation like this. So I just want to share, get the word out. You seen my post and then said, hey, do you want to share your story? And I'm like, sure, let's do it.
Cool. Yeah. Well, I really appreciate you sharing in there because over and over again, I'm stunned by how few people understand about the reality of a very low blood sugar, that they don't understand about glucagon. They don't know that they should be carrying it with them, that they should be telling people around them how to use it. All of that stuff is just super important. I know people don't want to be bummed out. They don't want to worry about things, but this is just being ready in case. And so the worst thing that happens is you never use the information.
Right. And it's better to have the tool that you need and not need it than to need it and not have it, because the alternative is not bright and sunny.
I think the happiest moment of any time, quarterly probably around here, is when you throw away an unused Gvoke HypoPen. When you go,
which
okay,
I'm about to do, because luckily that one didn't expire, but it's set to very soon.
Yeah, when I look at it and go, all right, this is expired now. We have a new one that came in. And you take that old one and you throw it away and you think wow, great. Glad to have had it. Even happier I didn't use it.
Glad I didn't need it.
Yeah. Best thing you'll throw in the trash ever. I do also sometimes mess with them and test on things so I can see how it works and stuff. But
well, we were definitely, we were gearing up to it. We were even talking about it. It's I would have one that my friend, my Don't Die buddy, was going to be able to, she's like, I want to play with the stabby pen when it expires.
Let me see it. Yeah. Well, it's a great idea. You inject it into a banana or something like that so you can see how it works. And it takes away a lot of the fear for somebody who, even you, right?
Yes.
It comes in this package. You never opened the package before. It's in the package. So you open it up and you're like, oh, is this what this is? And then, okay, here we go.
How do I do it?
Yeah.
Okay. And knowing that it's not going to like shoot me through the roof right after too. Like, cause that was a fear too. But I mean, obviously the low was more of a concern than the high at the time.
Yeah, it's actually interesting. I wonder how low you were going to get, because I mean, it's a real indication that you were probably going to have a significant problem if the glucagon never made you higher than 70 after that.
Well, I did go higher after that. So I think I capped out around 150.
That's still very reasonable, I think.
Mm-hmm.
You know? Wow.
Yeah.
Did you at any point yell, please don't pull my pants off? I'm wearing loose underwear. I don't want
no. Because we still don't know what loose underwear are.
There's no lady in the history of the world wearing loose underwear on purpose. I just want to say that now. This is my opinion. I'm not a woman, but I'm jumping to this conclusion very quickly. I would assume if your underwear was loose as a lady, you'd think to yourself, I need to replace my underwear.
Well, I would imagine. Yeah, like, or holy cow, I lost some weight.
What happened? My God, I'm swimming in these things.
Or, oh my God, I've had the same underwear for 17 years. It's time for a new pair.
Is there anything better, Tiffany, than throwing out old underwear? It's one of my favorite things. I don't know. It's one of my favorite things. Fun,
yeah,
I love it.
But I do enjoy throwing out holy socks.
Do you?
Yes.
Yeah. Underwear, like every once in a while, I have such a poor person's attitude because I grew up like so broke. Like my wife will be like, what's going on? Why are you so happy? I said, I bought 3 new packs of underwear, and I act like I'm Rockefeller. You know what I mean? I've bought 3 new packs of underwear, and I'm going to throw away the equivalent amount of old underwear today. I'm living like a king.
You are. And it wasn't even a birthday present or a Christmas present?
No. Just treating myself. Just treating myself. Like, I swear to God, I don't know what's wrong with me. I never feel more accomplished than when I do that.
You're like, I saved a life today. I'm going to go buy some new underwear.
I'm getting myself some new underwear. My God. So, go ahead and say that out loud for people one time. Go ahead. Did I save your life?
You saved my life? Mm-hmm. Absolutely.
With a podcast?
A podcast.
Ridiculous.
Saved my life.
Yeah. How about that? I'll be damned. Well, and you came on here and told the story very well. I appreciate it. You're very good at this, actually. Sure. You ever been on a podcast before?
Never.
No? You did a good job.
Awesome.
Yeah. And tell me something now. If I had you back on one day, we could talk for another hour about something completely different. No problem.
Well, absolutely.
Mm-hmm. Your note was like fantastic. Like every once in a while I get an email and it basically starts 7 years ago.
No. Well, I can't. I give you highlights. I can't give you all of it's like a preview, right?
Yeah. Yeah. That's really wonderful.
So I was at my endo yesterday, and we actually are discussing trying to get me approved for either Mounjaro or Zepbound. So I may have more to discuss.
Okay. Excellent. So based on how did your doctor ask for it?
Well, I asked for it.
Okay.
Because I still have weight to lose, because I start the insulin pump and I'm probably going through a pod every other day for the massive amounts of insulin I'm using. Mm-hmm. I do lose weight over time. I tried Ozempic, got terribly, terribly sick on Ozempic as another means to try to lose this extra weight that insulin has so wonderfully helped me gain. We tried phentermine pills, and that I think I lost close to 40 pounds since October.
That's half a fen, right?
Phentermine? I'm not really sure.
Is that right?
Maybe.
Isn't that a
yeah? Is it like a dietary supplement?
It's an appetite suppressant, but how does it work?
But it's not that part of it, I don't believe, because when it's usually prescribed with an appetite suppressant, but I didn't need the appetite suppressant problem, because if anything, I have an anti-food problem. Because of having to go through years of feeding insulin, the last thing I want to do is eat. I do not have the food voice that people have.
But this is a short-term use thing. Is that correct? You're not going to use it for long? Okay.
Correct.
Okay, because I'm just reading. I allowed my ChatGPT overlord to talk to me. It says, tells me about the mechanism of action, similar to an amphetamine, actually. It stimulates the release of neurotransmitters like norepinephrine in the brain. and which reduce hunger and help control appetite, but you don't have that problem. Usage, short-term use indicated for a few weeks as part of a comprehensive weight loss plan that includes diet, exercise, behavior modifications. Long-term effectiveness and safety have not been established. Okay.
Yeah, definitely not long-term. So I'm looking to get off of that at this point, right? So that's when my husband, who I diagnosed with the help of the podcast as type 2 diabetes.
Really? No kidding.
Currently on Mounjaro. So I ask about and knowing about your weight loss journey using Zepbound, I had inquired with her like, hey, like, what do we think might happen if I try that? Because my history with GLP-1s is usually gastro is just totally outweighs the benefits because I get terribly sick. But we're going to give it a try if we can get it approved.
Oh, good for you. I hope you see a significant reduction in the insulin you need and that it helps you with how much more weight do you feel like you need to lose?
I'd be probably happy with, according to a BMI scale, I probably need to lose another 60. I'd be happy with like another like 30.
I look at myself now and I'm like, I'm going to go with when I look right. Like I stop worrying about the number almost completely.
Right. I need to, and I'm very I'm proportionate. I carry my weight very well. Like, people would not think that I weigh what I weigh.
Yeah.
So it's less of that and more of just being healthy, because once I finally got the right diagnosis, once I got my A1C down, I feel 10 years younger. Like I feel so different. So I went from like changing a pod every other day to I wear almost every single pod unless I'm sick or something like that, like through to like the death beep.
Right out to the end. It has
right
enough
out
insulin.
To the end. So my total daily insulin went from over 100 to right around somewhere between 40 and 45.
Oh, that's so interesting. I have to tell you, going from 200 units in a day and a half to 3 days is a big deal already.
Mm-hmm.
You know, and then if you see another decrease with the GLP, it's going to be even more exciting for you. Really cool. And it should help you. It should help you. I mean, listen, I can't say enough good things about the GLP medication experience I'm having, you know, and I don't have diabetes, but my health is significantly better. The way I feel, to say is significantly better would be an understatement. I look better. Looking better is almost the least of my concerns, because I used to be burdened with that thing that you talk about, which is I carry the weight well. It's hard for people to tell. And that tricks you into believing that you're healthy because nobody notices.
Well, and I don't give a damn what other people think either.
Sure.
So that can be dangerous too.
Exactly. Yeah. And then the other side of it is that, you know, I've had both of my kids come to me at this point, Arden more recently. And she's like, hey, I was looking at old pictures of us and you were fat. I didn't know. And I was like, this is an uplifting conversation. Thank you. But it was interesting to hear from her that, like, you know, you slowly gain weight. Nobody notices, especially the people around you. And then you say things like, oh, I know I'm way more than I should, but it's probably just 20 pounds. I probably just need to lose 20 pounds. And then you lose 20 for me, at least. And I was like, oh my God, well, more than 20. You know, and then I was down like 30 pounds. I was like, well, I guess more than 30. And then you start realizing exactly how far you've slid and you didn't even know it. So anyway, it's been a lesson. I actually consciously had the thought this morning that it might take me 2 years from when I started the GLP to when I actually feel like I'm in an optimal health situation, but that I got to let the process play out and just keep doing the things that I know to do.
Right.
And I can't care how long it takes.
So, I mean, the thing that keeps kind of reverberating in my head is when you say, trust that you know what will happen will happen.
Yeah. Yeah. It's funny. I use that around diabetes, but it's pretty, you know, important in a lot of aspects of your life. Just trust that what you know is going to happen is going to happen, and just kind of just let it play out. Ends up being a big deal. And around the weight loss thing for me, especially because, you know, you have it in your head. An acquaintance that went on it, and I was getting the texts a week in. I'm still hungry. I thought this stuff worked. I haven't lost any weight. You know what I mean? Like, I'm like, hey, you know, I've been doing it for like 2 weeks, you know, like chill out.
Give it some time.
Yeah. Then finally a couple months into it, like, hey, I've lost 10 pounds. And I was like, hey, good for you. But you gotta, it's all the way you couch it in your head then. Cause what you could say is, well, just 10 pounds. You know what I mean? Like everything's kind of interpreted it in the way you decide to ingest it, if that makes sense.
Oh, it's totally, I always said, like, life is what you make it. Like, you're going to either view it like glass half empty, glass half full.
Right.
It's what you have to be your own advocate. You have to take in charge of your own life and make choices. And if you don't like the results that you're getting, then you need to look somewhere else.
Yeah. And sometimes you just got to put your head down and keep going too.
True.
Because you're not there yet. And you're just a little impatient, which is.
Well, that may or may not be impatient, but.
Well, listen, that lady you made cry at the pharmacy, she definitely thinks you're impatient.
I'm sure she does. But disclaimer, I was in line for over an hour and had to call my husband to go pick up my kids because I was going to miss picking up my kids at daycare because I was in line so long.
Listen,
at the pharmacy.
I'm okay with you yelling at her. It's fine. Sounds like you made out okay in the end. You walked out of there all triumphant with your insulin. You're like, I did it.
Got shut down. Yeah. Like, they're no longer in business. No,
she's still telling that story to anybody who will listen, probably. She's like, she really scared me.
Well, good. That means she learned her lesson.
Listen, do your job, everybody. That's my message. Like,
it's that easy.
Yeah.
Just do your job.
Tiffany had a goddamn life-threatening emergency at work and then was working again. Were your parents in the war? Where did you come up with this work ethic, by the way?
Middle class, paycheck to paycheck people who you just had to honestly, work hard for what you have.
Yeah. I used to watch my father go to work when he was sick. And I one day asked him, don't you have sick time? And he goes, yeah, I don't want to use it when I'm not feeling good.
Right. Like, it's summer. Like, I want to use this to go swimming or like go to the beach.
I didn't know that meant, dude, I'm broke. I can't just take off from work. I got to save this for a good day.
Well, there is that too. Plus I have, the little like spawn of Satan that gets sick and then require me to take off time as well. So
I thought this went very well. I appreciate you doing it very much. You hold on a second. I'd like to talk to you when I shut off the recording.
Sure.
But thank you so much. You were terrific.
Thank you.
Thanks for tuning in today, and thanks to Medtronic Diabetes for sponsoring this episode. We've been talking about Medtronic's MiniMed 780G system today, an automated insulin delivery system that helps make diabetes management easier day and night. Whether it's their meal detection technology or the Medtronic extended infusion set, it all comes together to simplify life with diabetes. Go find out more at my link, medtronicdiabetes.com/juicebox. The podcast episode that you just enjoyed was sponsored by Eversense CGM. They make the Eversense 365. That thing lasts a whole year. One insertion every year? Come on. You probably feel like I'm messing with you, but I'm not. EversenseCGM.com/juicebox. This episode was sponsored by Touched by Type 1. I want you to go find them on Facebook, Instagram, and give them a follow. And then head to touchedbytype1.org where you're going to learn all about their programs and resources for people with type 1 diabetes. Hey, thanks for listening all the way to the end. I really appreciate your loyalty and listenership. Thank you so much for listening. I'll be back very soon with another episode of the Juicebox Podcast. If you're looking for community around type 1 diabetes, check out the Juicebox Podcast private Facebook group, Juicebox Podcast, Type 1 Diabetes. But everybody is welcome. Type 1, Type 2, gestational, loved ones, it doesn't matter to me. If you're impacted by diabetes and you're looking for support, comfort, or community, check out Juicebox Podcast, Type 1 Diabetes on Facebook. The episode you just heard was professionally edited by Wrong Way Recording. WrongWayRecording.com.